11. Common remedies that are wiping out your memory without you realizing it. Have you ever forgotten where you left your keys? Have you ever had trouble remembering an important name or appointment? What if I told you that it's not just aging that may be affecting your memory? Some common medications, the ones that many people take daily, may be causing silent damage to your brain. Recent research reveals a link between certain medications and cognitive decline. Medications used to treat anxiety, insomnia, allergies, chronic pain, and even stomach problems may be affecting your ability to think clearly. But how does this happen? And what are the most dangerous drugs for memory? If you take any medications regularly, you need to know the risks they can pose to your mental health. By the end of this video, you'll find out which medications may be impairing your memory and how to protect yourself from these effects. Remedy number 9 is the most fatal, and most people abuse it. Let's get started. The shocking truth about aging and dementia that few know. For many years, it was believed that memory loss was an inevitable consequence of aging. However, recent studies show that this is not entirely true. Although natural aging can lead to minor cognitive difficulties, dementia and severe memory decline are caused by specific pathological processes. Neurodegenerative diseases, such as Alzheimer's, are responsible for most cases of memory loss, but they are not the only culprits. Other factors, such as lifestyle habits, diet, chronic diseases, and the use of certain medications, can accelerate this process. The impact of drugs on brain health has been widely studied. Substances that affect neurotransmitters, blood circulation, and inflammatory processes can impair the brain's ability to store and retrieve information. And the most worrying, many of these medicines are consumed without proper medical monitoring, further increasing the risks. Now, let's reveal the medications that may be impairing your memory. 1. Omeprazole. The stomach medicine that may be poisoning your brain. Omeprazole is one of the most widely used drugs in the world to treat gastritis, gastroesophageal reflux, and ulcers. It belongs to the class of proton pump inhibitors, which also include pantoprazole, esomeprazole, and lansoprazole. While effective in relieving digestive symptoms, these medications can pose a hidden danger to memory and cognitive function. Scientific studies point out that the prolonged use of these drugs may be associated with an increased risk of dementia. A study published in the Journal of the American Medical Association, JAMA, indicated that people who take proton pump inhibitors for prolonged periods are significantly more likely to develop cognitive decline compared to those who do not use these medications. But how exactly can omeprazole harm the brain? The main problem lies in the reduction of vitamin B12 absorption. This nutrient is essential for maintaining neuronal health, and its deficiency can lead to symptoms such as memory lapses, difficulty concentrating, and even mental confusion. In addition, omeprazole can alter the gut microbiota, which plays a crucial role in the communication between the gut and the brain. Another worrying factor is that many people use these drugs continuously, without proper medical monitoring. Ideally, the use should be restricted to the period indicated by the health professional, and that alternatives are adopted, such as changes in diet and lifestyle, to treat digestive problems without harming brain health. If you regularly use omeprazole or other proton pump inhibitors, talk to your doctor about the actual need for treatment and possible strategies to minimize the risks. After all, protecting your memory is just as important as taking care of your digestive system. 2. Anticholinergics. The folk remedies that are erasing your memories. Anticholinergic medications are widely used to treat a variety of conditions, including allergies, urinary incontinence, Parkinson's disease, and even insomnia. They act by blocking the action of acetylcholine, a neurotransmitter essential for communication between neurons and, consequently, for memory and learning. While effective for treating certain health problems, these drugs can have a devastating side effect: impaired cognitive function. Studies show that long-term use of anticholinergics can significantly increase the risk of dementia. Research published in the Journal of the American Medical Association, JAMA, revealed that people who use these drugs for long periods have a 54% higher risk of developing Alzheimer's and other types of dementia. Among the most common drugs in this class are diphenhydramine, present in many anti-allergy drugs and insomnia drugs, scopolamine, used for nausea, and oxybutynin, indicated for urinary incontinence. These drugs are consumed by millions of people without them realizing the risks they may be taking. The main problem with anticholinergics is that they reduce the ability of neurons to communicate with each other, directly impairing memory, focus, and even speed of reasoning. In the long term, this disruption in brain function can cause permanent damage, accelerating cognitive decline. If you regularly take anticholinergics, talk to your doctor to evaluate possible alternatives. In many cases, there are other treatment options with fewer side effects to brain function. Protecting your memory is essential to maintaining your quality of life and independence over the years. 3. Corticosteroids, the time bomb that may be weakening your mind. Corticosteroids are extremely effective drugs in fighting inflammation and autoimmune diseases. They are widely used to treat rheumatoid arthritis, asthma, lupus, severe allergies, and several other conditions. However, despite its usefulness, prolonged use can have severe consequences for the brain, directly affecting memory and cognitive ability. Studies show that the continuous use of corticosteroids can lead to atrophy of the hippocampus, the region of the brain responsible for the formation of new memories. This is because these medications increase levels of cortisol, the stress hormone, which, when in excess, can cause irreversible damage to brain cells. A study published in the Journal of Clinical Endocrinology and Metabolism revealed that patients who use corticosteroids for long periods have a higher risk of mental confusion, difficulty concentrating, and even depressive symptoms. Additionally, abruptly stopping these medications can cause withdrawal symptoms, including extreme anxiety and mood swings, which further impacts mental health. The most common corticosteroids include prednisone, dexamethasone, betamethasone, and hydrocortisone. Its prolonged use can cause not only cognitive decline, but also insomnia, mood swings, increased blood pressure, and weight gain. If you use corticosteroids regularly, it is essential to talk to your doctor about strategies to reduce dependence on this medication. In some cases, lifestyle changes, alternative therapies, or dosage adjustments can minimize the risks to the brain. Inflammation can be a serious problem, but protecting your memory and cognitive function should also be a priority. Do not ignore the signals that your body is giving, and always seek medical advice to ensure a safer treatment. 4. Benzodiazepines, the tranquilizer that can lead to forgetfulness. Benzodiazepines are widely prescribed to treat anxiety, insomnia, and even muscle spasms. Medications such as diazepam, alprazolam, clonazepam, and lorazepam are well known for their calming and sedative effects. However, what few know is that these drugs can have a devastating impact on memory and cognitive function in the long term. Research shows that continued use of benzodiazepines can cause an accelerated decline in memory. A study published in the British Medical Journal, BMJ, indicated that people who use these drugs regularly are up to 50% more likely to develop Alzheimer's and other forms of dementia. This is because benzodiazepines directly affect the hippocampus, one of the main regions of the brain responsible for storing memories. Another serious problem with these drugs is that they induce an effect of dependence and tolerance. This means that, over time, the body gets used to the substance, requiring larger and larger doses to achieve the same effect. In addition, its abrupt interruption can cause symptoms such as intense anxiety, severe insomnia, and even withdrawal crises, making cognitive recovery even more difficult. Patients who take long-term use of benzodiazepines often report symptoms such as memory lapses, difficulty concentrating, and a constant feeling of mental confusion. In some cases, these effects may persist even after stopping the drug, which reinforces the importance of careful medical follow-up. If you use benzodiazepines for anxiety or insomnia, talk to your doctor about possible alternatives. Behavioral therapies, lifestyle changes, and even herbal medicines may be safer options for preserving your memory and your brain health in the long term. Anxiety relief is important, but is it worth compromising your ability to remember and think clearly? Reflect on this and always look for the best alternative for your mental health. 5. Amphetamines. The danger hidden behind brain stimulants. Amphetamines are often prescribed for the treatment of attention deficit hyperactivity disorder, ADHD, and narcolepsy. Medications such as Adderall and Ritalin are widely used to increase concentration and improve cognitive performance. However, what few know is that prolonged use of these substances can cause serious damage to memory and brain function. These stimulants act on the brain by increasing levels of dopamine and norepinephrine, neurotransmitters that help regulate focus and attention. However, overuse can overload the central nervous system, leading to a rebound effect of mental exhaustion and memory impairment. Studies show that chronic amphetamine use can alter the structure of the brain, affecting areas such as the hippocampus and prefrontal cortex, which are responsible for the formation and retrieval of memories. In addition, research shows that individuals who use amphetamines for a long time have a higher risk of developing symptoms of anxiety, depression, and mental confusion. Another worrying factor is the risk of addiction. Because these drugs artificially increase neurotransmitter levels, the brain may become less efficient at naturally producing these substances. This means that, over time, users may have difficulty concentrating without the help of the medication, becoming dependent to perform everyday tasks. In addition, there are reports of users who, even after stopping the use of amphetamines, continue to present cognitive deficits, including difficulty remembering information and making decisions. If you use amphetamines, it's critical to talk to your doctor to assess whether the benefits actually outweigh the risks. There are natural alternatives and lifestyle changes that can help improve attention and cognitive performance without the dangers associated with these substances. The desire to improve focus and productivity is understandable, but is it worth compromising your brain health in the long run? 6. First-generation antihistamines. The cure that can cost you your memory. First-generation antihistamines, such as diphenhydramine and promethazine, are widely used to treat allergies, colds, and even insomnia. They are affordable medicines, easily found in pharmacies, and often used without a prescription. However, what many don't know is that these drugs can directly affect memory and cognitive function. Unlike more modern antihistamines, first-generation antihistamines cross the blood-brain barrier and have a strong sedative effect on the brain. They block the action of histamine, a neurotransmitter involved in various brain functions, including learning and retaining information. Studies show that long-term use of these medications may be associated with an increased risk of cognitive decline. Researchers at the University of Washington analyzed data from thousands of people and found that individuals who used first-generation antihistamines regularly were more likely to develop dementia. This is because these drugs have anticholinergic properties similar to those of drugs that block acetylcholine, a neurotransmitter that is essential for memory. In addition to memory loss, frequent use of these drugs can cause symptoms such as excessive sleepiness, difficulty concentrating, and mental confusion, especially in the elderly. Many patients who make continuous use of these substances report feeling disconnected and having difficulty processing day-to-day information. If you need to treat allergies or respiratory problems, consider safer alternatives, such as second-generation antihistamines, which have fewer side effects for the brain. Drugs such as loratadine and fexofenadine do not cross the blood-brain barrier with the same intensity, reducing the risk of cognitive impairment. Relief from allergy symptoms is important, but it shouldn't come at the expense of your memory. Always consult a doctor before using any medication regularly and be aware of the signs that your body and mind are giving. 7. Tricyclic antidepressants. The hidden price in the treatment of depression. Tricyclic antidepressants such as amitriptyline, nortriptyline, and imipramine have been widely used in the past to treat depression and anxiety. Although they are still prescribed for some cases, especially for chronic pain and migraines, these medications have an alarming side effect. They can impair memory and accelerate cognitive decline. These drugs work by blocking the reuptake of neurotransmitters like serotonin and norepinephrine, increasing their availability in the brain. However, they also have strong anticholinergic action, which means they inhibit acetylcholine, a neurotransmitter that is essential for memory and learning. Research indicates that long-term use of tricyclic antidepressants may be linked to an increased risk of dementia. A study conducted at Indiana University found that patients who regularly used these medications had faster cognitive decline than those who used other classes of antidepressants. In addition to memory loss, these drugs can cause excessive sleepiness, mental confusion, and difficulty concentrating. In the elderly, the effects can be even more intense, increasing the risk of falls and compromising autonomy. Currently, there are safer options, such as selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine and sertraline, which have less impact on cognitive function. If you use tricyclic antidepressants, it is important to talk to your doctor about the possibility of a more modern and safer alternative. Mental health is key, but treating depression shouldn't compromise your memory and cognitive ability. If you feel like your mind is slower or your memory has worsened, don't ignore these signs. Medical follow-up is essential to find the most balanced treatment for your well-being. 8. Statins. The paradox of the cholesterol drug that threatens your brain. Statins, such as atorvastatin, simvastatin, and rosuvastatin, are widely prescribed to lower cholesterol levels and prevent cardiovascular disease. Although they are effective in protecting the heart, studies indicate that these drugs can have a worrisome side effect: memory loss and cognitive impairment. The brain contains large amounts of cholesterol, which plays an essential role in the formation of cell membranes of neurons and the transmission of nerve impulses. Statins reduce cholesterol production, and some experts believe this can negatively affect brain function. Patient reports and clinical studies suggest that long-term use of statins may be related to memory problems, difficulty concentrating, and a feeling of foggy mind. In 2012, the U.S. Food and Drug Administration issued a warning about the possible cognitive side effects of statins, recommending that patients watch for signs of brain fog and forgetfulness. However, research on this relationship is still controversial. Some studies suggest that statins may even have a protective effect against dementia in certain cases, especially due to their anti-inflammatory action. The problem seems to be in the dose and individual predisposition of each patient. If you take statins and notice changes in your memory or mental clarity, talk to your doctor. In some cases, it may be possible to adjust medication or adopt complementary measures such as dietary and lifestyle changes to balance cardiovascular benefits without compromising cognitive health. The heart and brain are vital organs, and both need to be protected. Make sure that the treatment you are following benefits your health completely, without harming your memory and quality of life. 9. Opioids. The relief that can turn into cognitive loss. Opioids such as morphine, codeine, oxycodone, and fentanyl are potent medications used in the treatment of moderate to severe pain. While they are highly effective at relieving pain, these substances can have a devastating impact on brain function, especially when used long-term. Opioids act on the central nervous system by binding to specific receptors in the brain to reduce the perception of pain. However, they also affect areas responsible for memory and learning, such as the hippocampus and prefrontal cortex. This can lead to symptoms such as memory lapses, difficulty concentrating, and a persistent feeling of mental confusion. Studies show that long-term opioid use is associated with an increased risk of cognitive decline and dementia. Researchers at the University of Minnesota found that patients who used opioids chronically had a significantly higher rate of cognitive impairment compared to those who did not use the medication. In addition, opioids are highly addictive. Over time, the brain develops tolerance to the substance, requiring higher and higher doses to achieve the same analgesic effect. This can lead to dependence, making stopping the medication extremely difficult and further increasing mental health risks. Patients who use opioids for prolonged periods often report symptoms of mental fog, a sense of detachment from reality, and a decrease in thinking speed. These effects may persist even after stopping the drug, indicating lasting damage to cognitive function. If you use opioids for pain management, it is essential to talk to your doctor about possible alternatives. There are other therapeutic approaches, such as physical therapy, acupuncture, and less aggressive medications that can help relieve pain without compromising your memory and mental clarity. Chronic pain can be debilitating, but treatment shouldn't come at the cost of your cognitive health. Balancing pain control with memory preservation is key to maintaining a good quality of life. 10. Antipsychotics, the silent killer of your mental clarity. Antipsychotics are essential medications in the treatment of severe psychiatric disorders such as schizophrenia, bipolar disorder, and psychosis. However, its prolonged use can have significant consequences for memory and cognitive function. Medications such as olanzapine, quetiapine, risperidone, and haloperidol work by reducing the activity of neurotransmitters such as dopamine and serotonin. While this helps control psychotic symptoms, it can also compromise areas of the brain responsible for learning, reasoning, and memory. Studies show that long-term use of antipsychotics can lead to brain atrophy, especially in regions such as the prefrontal cortex and hippocampus, which are essential for storing information. Research published in the American Journal of Psychiatry indicated that patients who use these drugs long-term have a higher risk of cognitive decline, with a reduction in brain volume seen on imaging tests. In addition, antipsychotics can cause side effects such as excessive sedation, difficulty concentrating, and a persistent feeling of mental sluggishness. This directly impacts the patient's quality of life, impairing their ability to perform day-to-day tasks. While in some cases the benefits of these medications outweigh the risks, it is critical that their use is closely monitored by a healthcare professional. Dose adjustments, medication changes, or even the adoption of complementary therapies can minimize the negative impacts on cognitive function. If you or someone close to you is on antipsychotics and has noticed worsening memory or mental clarity, talk to your doctor about alternatives or strategies to protect your brain health. Psychiatric treatment is critical, but it must be balanced to ensure the complete well-being of the patient. 11. High blood pressure. Meds. The bitter surprise that may be stealing your memory. High blood pressure medications, known as antihypertensives, are essential for millions of people in controlling hypertension and preventing cardiovascular disease. However, some of these medications may have a little-known side effect: memory loss and reduced cognitive ability. Among the antihypertensives that can impact brain function are beta blockers such as propranolol and atenolol, and thiazide diuretics such as hydrochlorothiazide. These medications work by lowering blood pressure, but in some cases, they can decrease blood flow to the brain, affecting the supply of oxygen and essential nutrients for nerve cell function. Studies indicate that long-term use of certain antihypertensive drugs may be linked to an increased risk of cognitive decline. Researchers at the University of Bordeaux in France analyzed data from elderly patients and found that those who used beta blockers for long periods had a higher incidence of memory impairment and dementia compared to those who used other classes of medications. Another worrying factor is that very low blood pressure can impair cerebral perfusion, compromising communication between neurons. This can lead to symptoms such as mental confusion, difficulty concentrating, and feeling constantly fatigued. This does not mean that high blood pressure drugs should be abandoned, but rather that their use should be closely monitored by a health professional. In some cases, medication adjustments or lifestyle changes such as a balanced diet and exercise can help control blood pressure without compromising cognitive function. If you are on continuous use of antihypertensive drugs and have noticed changes in memory or mental clarity, talk to your doctor. There are different classes of medications, and it may be possible to find an option that keeps your blood pressure in check without affecting your brain health. Heart and brain health go hand in hand. Ensuring a balance between blood pressure control and memory preservation is essential for healthy aging and quality of life. Now that you know the 11 medications that may be silently impairing your memory, it's time to take action. Many people take these drugs without knowing the risks, but information is your best tool to protect your brain health. The good news is that in many cases, there are safer alternatives or adjustments that can be made to minimize the negative impacts of these medications. The first step is to talk to your doctor. Never interrupt a treatment on your own, but question, ask about other options, and always seek the best solution for your body and mind. Also, keep in mind that your lifestyle also plays a crucial role in preserving memory. A balanced diet, quality sleep, physical exercise, and brain-boosting activities such as reading and continuous learning are natural and effective ways to strengthen your mind and reduce the risks of cognitive decline. Taking care of your mental health is not just about avoiding diseases, but about ensuring a full life with clarity, autonomy, and well-being. Your brain is your greatest asset. Protect it today so that it continues to perform at its best for years to come. If this content made sense to you, share it with those who need this information. The more people know about the risks and the alternatives, the more lives can be saved.